I'm your host, Scott Setti. I'm a partner in the healthcare executive search practice at Heidrick & Struggles. And today, we're privileged to be joined by Peggy Troy, the CEO of Children's Wisconsin, one of the most prominent and successful independent children's hospitals in the country. So welcome, Peggy. Thanks so much for joining us today. We really appreciate it.
Well, thanks, Scott, and I'm looking forward to the opportunity to talk about culture at Children's.
You've led at Children's Wisconsin a very significant cultural transformation when you became CEO. So we're eager to hear about some of your thoughts on that topic. Let's start with this. You're an exceptionally strong advocate for culture. Why is culture so important to you and to Children's Wisconsin?
Well, I'll start out by saying the patient experience can't exceed the staff experience, and I firmly believe that. So we're a service organization. We are here to do good things for kids and their families, and we have to be a great place to work to provide that very best and safest care and accomplish our mission and vision. So in the absence of a great culture, you're not going to be the best at what you're trying to accomplish because it's all about the people. And so I firmly believe that culture is one of the most important aspects of a CEO's life as a leader.
When you became CEO, why did you think that the hospital needed to change its culture? What wasn't working at that time, and what effect did that have on the patients and staff?
So when I came to Children's back in 2009, I experienced an organization that had done many great things and has many aspects to the organization that typically a hospital wouldn't have. So we do have a hospital in all of our ambulatory clinics. We're an academic institution, so we have a relationship with a medical college of Wisconsin. We also have a Medicaid and Affordable Care Act health plan. We also have the largest foster care and adoption agency in the state of Wisconsin that's very entrenched in well-being. And so when you think about all the touch points that we have with kids, we weren't an integrated system. Everybody was doing everything in their discrete little company and weren't working as an organization that wraps ourselves around the kids. And so I realized that we were going to have to do something radically different, starting with ourselves as a senior team, but then also how we would filter that through the rest of the organization. Because when people come to Children's, they come to us thinking that we're integrated. And what I heard from families is that, and staff, is that we weren't taking advantage of how we could shape up for kids and look at them more holistically. The other thing is we did not have an electronic medical record that was comprehensive. And I knew we were going to have to go through a radical transformation in order for us to be successful to implement a comprehensive electronic record that served all aspects of our organization. The change management that's required to go into something that massive required us to think about how we relate to one another in a very different way. And so that led me to believe that I needed to find a way in which we could incorporate a new sort of idea around culture that would be engaging, embracing, and not just sort of a flavor of the day book on a shelf, way in which you want the company and the company employees to behave. It had to be real, and really said, okay, of course, they asked me, what are your values? And I'm like, well, I don't think we've got any really written down on a piece of paper, so we need to really work on this. But we did an exercise where we had about 240 of our leaders in a room together for a couple of days and really went through a very, very rigorous process to determine, okay, what do we really stand for? What are the values that are going to drive our mission and vision that we're going to embrace as leaders, but also employees can embrace as well, and use that as sort of the framework by which then we embedded the culture work. We developed those in 2012, and they're still alive and well today.
What other factors were critical to change the organization's culture?
I think the fact that, first of all, there was an organized approach, and it has to be led by the CEO. If it's not led and embraced and continually led by the CEO, I will tell you that it will be very fragmented. But when you put your stake in the ground as a CEO and say, no, this is what I believe in, and this is what I really know to be a way in which we can give our best and safest care to our kids and firmly practice it, I think that the credibility factor on this, the other factor I think that was really important in the design of the culture work through the Sendelani product was it was about you. And in fact, I had several testimonials after people went through their At Our Best training that said, boy, I kind of dreaded going to it. And I just kind of thought, oh, well, whatever, I'll spend a day and a half of my time and then I'll go on with my, but there was epiphanies that occurred in people's lives themselves that made them realize that this was helping them as an individual be a better person. The language. And I think having common language was another incredibly important part of this that we still use today. So when you think about people are stressed and there's dichotomy of opinion, we sort of balance things and say, can we stay curious? And that, I'll tell you, that word in our organization level sets. I'm not against you, you're not against me. We're just trying to solve problems together. So let's be curious with one another, try to get inside each other's head. Let's listen for understanding, and then we'll make good decisions together. And then also tying it back to your mission and vision and what you're trying to accomplish is so important. I mean, we want to give the best and safest care. Our vision is we want the kids of Wisconsin to be the healthiest in the nation. So when we can support that through the culture work with our values, it gets people inspired, it gets them excited, it gets them, energized and connected in ways that I don't know that we would typically see.
Let's focus on the physicians for just a moment, because that's such a key, important piece here. What did you do specifically to engage the physicians in this process, whether it's at the beginning or maybe through the process? And then your background, you're a nurse by training. So did your clinical background provide any additional benefits to getting the physicians or the clinicians to buy into this cultural transformation?
I think the answer is yes. And so I started out with the physician leaders in the original group. So they had the opportunity to experience it. And they went kicking and screaming, really? 2 days? Are you kidding me? No, just trust me. This will be good. By the end of the 2 days, they were hooked. They thought, hey,
Right.
especially when you drew, there's one part of it where everybody has a piece of paper on their back and you put it into quadrants. And are you a supporter? Are you a influencer? Are you a control freak? And so what we all did with one another is we went around and marked on people's backs a little, check of where we saw people. And it was interesting because some people were, evaluated very differently than how they saw themselves. That was really, for one of our physicians who thought he was more of a promoter or supporter, who was off in the autocratic space, like he needed another piece of paper. It was a lightning rod for him because he hadn't really realized that's how he showed up. And so I think having your physician leaders agree that this is something that they'll support is incredibly important. Thank goodness we did this, because we were a team aligned with one another, with our physicians, making important daily, sometimes hourly decisions, but everybody felt like they had voice, they were heard, they were respected, and that we were able to accomplish this and navigate our way through it, aligned with one another, and keep our employees safe, keep our providers safe, keep our families safe, and do all the things we needed to do in a COVID environment.
What's one piece or maybe a couple of pieces of advice that you would give to other CEOs about creating and maintaining a thriving culture?
Own it. You got to own it. You got to believe in it. You got to practice it. You got to live it. And it can't be a book on a shelf.
Again, Peggy, thank you so much for your time and your candor today. It was great spending this time with you. And I know that everyone is going to benefit from the words and wisdom that you've provided to us today. So thank you again for your time. Really appreciate it.